we're back here at Cooper Creek Square. Be sure to stop by. 20 great restaurants and shops right here on Highway 40, just as you come into town on the corner of Highway 40 and Vasquez Road. Still here with Jenn Fanning, the Executive Director of Grand County Rural Health. And obviously, Jenn, a lot of huge changes in the healthcare industry and world in the last year or two. And a lot of information people either don't know, don't want to know, or are overwhelmed, I should say, is more of a better way to say that. And you guys can help in a great way, or in a great many ways. What are some of the ways that you guys have addressed that, and what are some of the opportunities people have locally to get more information and get steered on the right path?
Sure, absolutely. Well, first, locally, we have, again, the Patient Navigator program. Anybody who has any kind of questions, we can help answer.
So this is even, I'm not insured, and you guys can, that's part of the navigation, is let's get you to a...
Yep, let's get you to a medical home. We're really focusing on everybody having a primary care provider that they go to on a regular basis instead of doctor hopping. It's better for you. It's better for your health, for the doctor to understand and know your patient history. So that's one of the big things that we're really focusing on in the healthcare world now is really medical home. Everybody should have that medical home. It should be you driving your care, not whatever the doctor says. It should be a partnership.
Yep.
So, and that's what the Patient Navigator program helps with that. We also convene and work with all the local healthcare providers. We have a healthcare professional society that we work on, and we're working on really the systems level. So things that we can change systemically here locally that we have power over. We don't have power over what Medicaid or health insurances companies charge for, whatever, but we can do things in the local systems, like the app I was speaking of earlier, that really make a difference, really improve patient care, and really can help drive innovation in the state as well. So,
just from some nuts and bolts, I'm seeing things on TV about if you're not insured, you're going to get a tax hit or a fee basically put on your taxes. I don't know anything about insurance. I mean, I have insurance, but if I didn't, I'm blind to this. I call you guys. Is there somebody I can sit down with, or what's this process? I know there's some Medicaid. There's various channels. Is there someone that I can talk to through you guys?
Absolutely. We have 2 health coverage guides, who that's their sole role is to educate you on the whole health exchange. Connect for Health Colorado, they can help enroll you in Medicaid and Connect for Health Colorado, and they work tirelessly and around the clock. They do an amazing job.
And now these guys are positioned in town too, that you can pop in and see them. You don't necessarily even need to call.
We have a great partnership with the library district, so they have office space basically in each one of the libraries.
So not just Fraser Library?
No, it's everywhere
Granby
in
Library.
the county.
Okay. Oh, all of them?
All of them in the county and in Jackson County as well. And you can get that information from our website as well as the community calendar.
So they have set hours that you can just pop into the library?
You can pop in. Especially this time of year, we do ask that you give a call just to set up a schedule so that you're not waiting for a really long time because they're really busy.
Our population goes up during the winter and then back down in the spring.
Well,
fall.
And it's open enrollment time for the health exchange.
Well, explain that a little more. What is an open enrollment?
Sure. So with the implementation of the Affordable Care Act, right, Obamacare, is Connect for Health Colorado. It's the only place in the state where when you enroll in health insurance, you can get a tax credit. So if you make a certain amount of money, you don't have to pay the whole cost of health insurance. You get a tax credit based on your income.
So back to our ski bum we were talking about earlier. It might not break the bank to get health insurance.
It might not.
Their wage might not put them over any limits, and they might be able to get some
help.
Correct,
and or they might qualify for Medicaid, which is an amazing thing that the state of Colorado has done, and opened that up to adults and expanded the income eligibility as well, and it's made a huge difference in the lives of a lot of people. So yeah, there's open enrollment. It goes until February 15th. If you want insurance this year, you need to enroll by February 15th. Please start early.
And what happens if it's after February 15th?
After February 15th,
we're talking next year, huh?
We're talking next year unless you have a major life change. So if you lose a job, you get a new job that doesn't offer insurance where your previous one did. You get married, you have a kid, you move into the county, or not the county, I'm sorry, into the state. Things like that, a major life change, then you can enroll through the tax credit as well.
Else remain uninsured until next January 1st?
Or remain uninsured until next year and get the tax penalty on your taxes.
Any idea what a penalty looks like?
Sure. So the penalty for 2014 that we'll see this year for when people file their taxes for 2014 was $95, or a certain percentage of your income, to a maximum of, I think, 8%. And then for 2015, it'll be $295. And so it's going to incrementally go up until...
And so for someone that doesn't make a lot, A, that's a big chunk of money, and B, they might have gotten a lot of help that they could have even paid less to be insured than they would have paid to not be insured.
There's some people who are paying $10 a month for health insurance. Some people are paying significantly more than that, but are some people...
This fee could end up costing you more than it would have cost to have insurance, and you'd be insured.
Eventually, it goes up incrementally until 2017, I think, and so then it'll definitely be much more than to have insurance.
So if I'm a procrastinator and February 15th is coming up, do I need to get in and see someone
now?
Now, right? Let's get the
get
get
in
the ball
now.
rolling.
Yeah, it takes about 5 to 7 business days.
This isn't the tax deadline where you want to call up on April 14th
right.
and say, let's get my health insurance by tomorrow.
Right. It takes 5 to 7 days to get through the system. The system has had a lot of issues. We're working on that too. We're advocating constantly to the state to Connect for Health Colorado. I have gone down there recently for a board meeting to make sure that our consumer voices is heard about some of the issues that, you know, they're used to hearing about Denver, and there's some glitches for people who have seasonal or abnormal income. They need to know about that. We need to make sure that that is available.
We definitely have a non-traditional lifestyle amongst a lot of our
absolutely.
folks in town.
So yeah, and so some of those things can cause glitches. That said, if you get started and you don't even have health insurance by the 15th, they will still work with you. Since you have started to, and because of some of those glitches, they're really aware of that. So yeah, go see the health coverage guides. They're amazing, amazing resources.
Well, that's awesome. Well, you know, thanks. You guys do such an incredible, or fill such an incredible role in this community in town. And thanks so much for coming on the show. I hope to have you back sometime. With that, we're going to wrap up the show. I got to get out there and hit some corduroy myself. So thanks for sticking around with us. It's been a great show. Thanks to Jenn Fanning here with the Grant County Rural Health, Steph Carey with the Cooper Creek Square, Blanton's Barn and those guys. What a fun group. And then, of course, Casa Mexico and all their treats. With that, we're going to take off, but have a great day, and we'll see you tomorrow.